Immediately after the birth, we experienced something was not okay with his eyes. So the nurse recommended that we should make an ultrasound scan from his brain. And this is when they noticed there is something, but they didn't know for sure that it was a tumor, and they recommended to do an MRI scan. And there we realized that it must be a tumor. So the doctor said that we should make an operation and take it out immediately.
So this little patient was diagnosed with a brain tumor that seemed to be arising from the most inner part of the brain, which is called the brain ventricle. These are fluid-filled cavities inside the brain, and they contain the fluid of the brain, which is called the cerebrospinal fluid. And they contain a special tissue that's called the chorioid plexus, and this tumor looked like one that arises from the chorioid plexus. Most of these tumors are benign and slow growing, but a small minority becomes a more malignant, aggressive type, so it needs to be removed. Also, the benign ones can cause problems by blocking the circulation of the cerebrospinal fluid, and it can cause hydrocephalus, which is normally known as water on the brain problem. So that's why we always opt for a removal of the tumor. As I said, we chose surgical removal, which went really well. It was completely removed, and there were no problems after that, so the post-operative stage went smoothly.
Right after the surgery, we had a great relief, because the doctor said that it went well, and it was actually, see the smile on his face was a great relief for us. We had two wonderful doctors, Dr. Erős and Dr. Markia, and they are both of them are very professional, and the two of them were in the operation. And of course we had Dr. Pálint who were checking on the baby before and after the operation. During our stay we had a lot of support from the very first moment when we entered the building. They were really trying to make us feel like home, and always telling us what will be the next step. We were always informed, and yeah, it was the stay was bearable this way.
In case of pediatric brain tumors, we always choose radical surgical removal whenever it's possible safely for the patient. It is shown that the best results and outcomes are related to the extent of the surgical resection. When the tumor is very big in size, we have to treat secondary hydrocephalus problem, so the water on the brain problem, that this can be treated as well with the procedure that is called the ventriculoperitoneal shunt insertion. So in our hospital we treat 1 to 3 plexus papillomas per year. And in the recent years, so in the last 4 or 5 years, they were all benign in nature, and they were all resected completely. And the 1 year survival was 100%, and there were no major complications or even small complications at all.